Thank you. My name is Kevin Lawrence. I'm the Director of Finance Performance for the Murrumbidgee Local Health District. Today I would like to go through the major points of interest with regard to financial results of the Murrumbidgee Local Health District for the 2021 financial year. I would also like to spend a little bit of time discussing the impacts of COVID on our activity and our finances. Murrumbidgee Local Health District is reporting a net surplus of $69.8 million, with revenues exceeding total expenses for the year. It is, however, important to note that the LHD was budgeted to exceed revenue by $66 million, and is such reporting an unfavourable position of $3.8 million for the year. The LHD reported expenditure of $734 million against a budget of $712 million, an unfavourable position of $21.8 million. The LHD continues to face a difficult financial environment, with this year's result being a slight improvement on the prior year and improved by $2 million. The 2021 financial year has been an extremely challenging year with the ongoing impacts of the COVID-19 pandemic response. The LHD continues to work closely with the Ministry of Health and other relevant stakeholders to improve the financial sustainability of the LHD. Total expenditure increased 5% compared to the prior year, with expenditures on the COVID response contributing $21 million to this increase. Employee-related costs were generally in line with the prior year, with an accounting adjustment for long service leave reducing the reported expenditure levels. Other expenses increased by $24 million this year. Approximately half of this increase was associated with the COVID response. Increases were also seen in capital expensing of $3.7 million and health technologies an additional $2.6 million. Depreciation also increased relative to the prior year, with recent new capital builds now being depreciated. Revenues increased slightly year on year, with recurrent allocations increase of $46 million being offset by reductions in other revenue streams. Increases in recurrent allocations resulted from the Ministry of Health support for the LHD's COVID response, totalling about $33 million, and the increased budget funding as part of the FY21 service level agreement. The Statement of Financial Position, or the balance sheet, is a statement of the LHD's assets and liabilities as at the 30th of June 2021. The LHD's asset base has increased by $70 million in this financial year. Most of this increase is associated with an increase in non-current assets for the organisation, with capital asset additions increasing the asset base. I will provide further details on the capital program shortly. Overall, liabilities remain consistent with the prior year. A reduction in payables were offset by an increase in employee leave provisions. Impacts of COVID and surgery programs impacting the ability of staff to take leave. As you can see, New South Wales Health continues to invest in capital programs within the LHD. Significant financial investments were seen at Wagga, Griffith, Tumut, Harden and Hay, with a number of other facilities also having capital improvement programs undertaken. As everyone is aware, COVID-19 has had a significant impact on society. I would like to take a little bit of time now to illustrate how COVID impacted on the activity of the LHD, and also provide information as to how the LHD responded financially. The LHD spent $33.1 million in response to the COVID-19 pandemic in the 2021 financial year. It is important that we recognise that the LHD was supported by the Ministry of Health, who provided significant financial assistance to the LHD in our response. As you can see, major areas of expenditure were the waitlist reduction and outsourced activity program, which is about $7 million. Pathology, we spent approximately $6.7 million. We spent approximately $3.8 million on providing PPE for our staff. Our COVID clinics cost us approximately $3 million. Mental health, about $1.7 million. ICT telehealth, $1.1 million. And with the emergency management program, about $1.2 million. COVID also has had an impact on our activity. Our bed days remain lower than prior years, with signs of normalisation seen in the last 5 months. Much of the activity increase was driven by the surgery recovery program, particularly at Wagga Base and Griffith Base hospitals in the second half of the year. Bed days at the rural sites remained low relative to prior years, but did show signs of normal activity over the last 4 months of the financial year. Overall, mental health bed day activity remained lower than the 2 years prior, but bed days for mental health increased in the second half of the year as bed capacity for non-COVID activity returned to normal levels. Activity for renal dialysis has increased in each of the last 2 years, with activity this year 27% higher than 2 years ago. Most of this increase is seen at Wagga and Deniliquin. Surgery levels increased 13% last year compared to the prior year, with an additional 2,252 surgery cases. Surgery was also higher than the 2018-2019 financial year, up 1,215 cases. Most of this increase resulted from the additional surgery to catch up from the impacts of COVID, with activity reducing in Q4 of the FY20 financial year. By the end of FY21, the number of patients on the waitlist had reduced by nearly 700 and was back to similar levels 2 years ago. The LHD had no surgical overdue patients at year end. ED activity remains suppressed relative to prior years. FY21 is down by about 5.5% compared to last year and was lower than FY20 by about 11%. The reductions in activity were most evident in triage categories 4 and 5. The reduction in ED activity was mostly seen at Griffith and the regional sites, with ED activity at Wagga Base normalising early in the financial year. Overall, non-admitted activity has increased 14.8% compared to the prior year, 17.7% compared to 2 years ago. COVID contributed significantly to this increase. Adjusting for COVID, the relative increases are 3.8% compared to last year and 3.3% compared to 2 years ago. Virtual health activity increased during the pandemic. The LHD pivoted to virtual services quickly in the last quarter of FY20 when the pandemic started. Activity has returned to a new normal this financial year, which is slightly higher than the pre-pandemic levels. The LHD has recently received its formal 2021-22 service level agreement, which contains the budget allocation for this new financial year. The LHD's expense budget has increased by over $29 million, or 4.4%, to a total of now $687 million. The own source revenue targets have decreased by approximately 1.7%, or reduced by $1.9 million to a target total of $106 million. As usual, the audited financial statements are available on the MLHD website. Thank you for your time.